I wanted to welcome you all to the Board of Directors meeting for the Healthy Start Coalition of Orange County. Let the secretary note that the date is August 2nd, 2013. First thing I wanted to address was that our former treasurer has resigned. Our new candidate for the treasurer position is currently in the hospital. He is recovering well though, so we expect him to be back very soon. Dr. Evers Robinson. So would anyone like to second the notion that he become our new treasurer chair?
I second that motion.
You second?
I third that motion.
All right. Motion passed. Vice Chair Dr. Lauren Joseph, what do we have on the agenda for the meeting this afternoon?
Well, I'd just like to say that the media interviews, first of all, consisted of a radio interview about moms not being able to afford diapers. The same interview was aired on NPR, which I think is great coverage because so many people, and especially parents, listen to that network, and it's national public radio. So it wasn't just in Florida. So I think we gained some national coverage instead of just local. So I think that's really good. Linda and Erica Burrows also did a two-part interview on Orange TV highlighting infant mortality and racial disparities, which is, of course, a common problem. So to get that out there as well, I think is good.
And that is certainly our goal, is to get that message out there.
Yes. And another huge help to our organization as of now is the Affordable Care Act visitation funds. They're finally available for us to use. Unfortunately, the first round of funds were not applied to the first round of funding for families, for certain families, but they will be definitely supplied for the second round because of the there was some mishap, but we've gotten it under control and taken care of with the certain people, so we can now move forward with that.
Okay.
So I think that'll be good.
All right, well then, Secretary, will you please note that these changes will happen within the next couple of months? Is there anything else you'd like to add, Vice Chairman?
I did want to add one last great thing that I think has happened. The newest campaign that we have running, the Boot Camp for Dads, our first round of classes with the dads that we had has ended, and we collected the data from that, and I would like to just show everyone the results that we got, because I think, in my opinion, they're phenomenal, and it's a great way to further this campaign. So, the first thing we looked at was caring for the baby, which consisted of just normal feeding and burping and just the normal day-to-day care, not so much the bigger things, but that has risen to 94.5%, which I think is great. Form a parenting team, which is like, it's more so with the significant other, or if they're not together, at least the mother of the child. So that boosted all the way up to 92.6%, which is also pretty great. Quieting a crying baby, we use methods like swaddling the baby in a blanket or just bouncing them, just certain techniques that would kind of help, and that's moved up all the way to 94%. And
Excellent. Okay.
The last one we looked at was bonding with the baby, like kind of how a mother would, but obviously it's a bit more difficult for dads sometimes because of, they're more masculine. So bonding with the baby, I think, even though it's not as high as the other results, 82.8% is a huge jump from where they were before, from the original pre-questionnaires. So these results, I think, in my opinion, represent that we should continue with this campaign and just try and improve all the dads here in Orange County. So.
Okay. Please correct me if I'm wrong. This data was derived from interviews with the fathers, correct?
We did a pre-questionnaire and a post-questionnaire. So basically, we asked them a type of questions on how they dealt with the baby in these 4 different variables, and then we took those answers and then we analyzed them with the post-questionnaires, which were the same exact questions, same questions and same style, and then same variables. And this was just the jump from, I don't have the other ones on me, but these are definitely how they've jumped. And I can tell you from memory that they were significantly lower.
Yes, so. That certainly is an improvement for the fathers caring for their children. So with that said, we will continue the Boot Camp for Dads campaign. Please note that, Secretary. And then we will check back within the next month or so and see, look at the analytics and the data and see where we're at with that. Okay, Secretary, is there anything you'd like to add to the meeting?
Yes, I just want to let you guys know that last week I met with Carrie Steven and she gave me an update on prenatal and postnatal screening rates for the period of July 1st through June 30th. And Carrie reported that she will be facilitating a breakout session for community coordinators at the FHSC conference next week. So we really want to utilize an electronic HS prenatal screening form.
Wow,
I think
okay.
that'll be much easier for our technical system, so.
Yeah, she was
I
really-
agree.
With the board of parents and stuff, so.
Okay. Is there anything else you'd like to add, Secretary?
Well, the Resource Development Committee, they've met and is looking for a possible fall fundraiser. It's called Bowling for Babies. So I think this would be a great way for the families to get involved.
Okay.
And that would be great, especially for the kids and the parents. Just a good way to spread our message in a friendly, nice, fun environment.
Okay,
So,
I think that sounds like a great idea. And will there be some kind of social media as well as a photographer at this event?
definitely, there's gonna be a photographer and there's gonna be people from our website area to kind of write a little notice on our thing, on our website, I'm sorry. And we might post something on Facebook about it as well. I'm pretty sure we'll make a Facebook post just to get it out there further.
Okay, I definitely believe taking a social media angle will do great wonders for our organization. Is there anything else that anyone would like to add to this meeting?
No, not at this time.
All right, well, I hereby call this meeting adjourned. All right, I first am going to begin with the history of the Healthy Start Coalition. It was started in 1991 by Lawton Chiles, who was the governor of Florida, as well as the first lady. This is actually him pictured right here. This is Lawton Chiles. So when it was established in 1991, basically it was the first lady and the governor got together and they knew that the infant mortality rate was very high throughout the entire country. So they thought they would start to work with the community and build coalitions to help target that. They wanted the infant mortality rates to go down, and so that is exactly why the Healthy Start Coalition was started. As of right now, there are currently 33 branches. The Orange County branch is located right downtown. It's in a beautiful area, and basically at these coalition centers, they target young women who are pregnant, and basically they want to improve maternal and child health. That is the main goal of this coalition.
So I'm going to talk about the Healthy Start Coalition of Orange County's norms, goals, and different roles in their organization. Some of their norms, they have monthly board meetings, as you saw from our previous skit in the video. They list their attendees at the meetings, that's another norm, and changes to previous monthly board meetings so they can just have that on record for their files and for public record as well. Another norm is to have a majority vote to make any decisions, so everyone is collaborating together and they make decisions by voting on it, and if it doesn't get approved, then that's it. And another norm that they also address at these board meetings is any new legislation, for instance, the Affordable Care Act, like we also talked about in the board meeting, to anything that can help that's been passed in recent months since the last board meeting can be implemented into the organization. One important thing to note is that the state of Florida is ranked the third lowest in the states with the lowest amount of children with children's insurance. So that is a big thing with this organization, and that's why they're so concerned about it, and they want to get mothers help. So some of the roles that they have at the Healthy Coalition, or the Healthy Start Coalition, is they have a board of directors who you saw and we've named before. They have community liaisons, an accountant, a human resources director that deals with kid care, which is a huge thing in Florida for children's insurance to let them get care that they need. And people that are specialized in certain community outreach programs. So that definitely broadens their horizons as to who they can come to for help and other supplies or resources that they might need. And their main goal, which is mentioned by Rachel earlier, is to ensure pregnant women have access to care and to improve maternal and infant health while reducing the number of preterm births, low birth weight babies, and infant mortalities, which of course is very important. And as we have researched other organizations that have done this as well, and March of Dimes, who was originally created by Franklin Roosevelt, it was originally created to fight and treat polio, but today they share the same goals as the coalition, and they are fighting against the premature birth epidemic. So I think with the help of the coalition and March of Dimes and many other organizations that have similar goals as this, we can really make a difference.
For the Healthy Start Coalition, we felt that the best way to study or research this type of organization was to first reach out to the members. We reached out to them via phone and email, and they responded to us with great facts and knowledge to help us understand how they work. Also, we believe that researching organizations that were similar gave us a better understanding to compare how they all work in the same way. We looked at their partnerships, March of Dimes, hospitals, local medical doctors, and this also was able to help us understand how they run their organization. We also feel that researching the actual meetings, such as the one that we gave an example for in the beginning of this, was able to help us to know how they come up with ideas, how they approve certain things, and it really helps us to know how they function. So that is the best way to research this organization.
After doing some research, this is the Healthy Start. This is the logo that they use to get the word out. As mentioned earlier, this is a picture of Lawton Chiles, who is the governor of Florida and who helped establish Healthy Start Coalition. These are just a few things that the organization is known for, which is social support, childbirth, parenting, nutritional counseling. We also included a picture of a pregnant woman because this is the audience that this coalition caters to, as well as the Orange County logo as well. And lastly, this is a picture that we have included for one of the events we talked about during the board meeting example we used, which is Bowling for Babies, and that took place in October. So thank you for listening to our presentation.